Hello, welcome back. This is this week's episode of Am I Going to Die with Melissa Moritz, your hostess with the mostest. And I have a special guest with me today. Would you like to introduce yourself, Dr. Wan?
My name is Johnny Wan. I'm an ear, nose, and throat surgeon. I've been doing it for about 20 years.
20 years, wow. And you're a veteran, right?
I am. Retired Navy.
Awesome. Is that the hoo-ha?
Hoorah.
Hoorah. Hoorah. I was close. Hoorah.
Hoorah.
Well, thank you for your service.
Thank you.
So today we're talking about, am I going to die from sinus infections? And we brought an expert in to talk about what they are, how they make you feel, what you could do about them, and then can you die from them ultimately? Oh,
Yes.
he's not going to dispel. Wait, yes?
You can.
He was kind of going to dispel the myth and the fact already. But so tell us a little bit about like what causes a sinus infection and what are they? How do they make us feel?
So we have these air pockets in our facial bone and skull that are our sinuses. We think that they might have something to do with making our head ultimately a little lighter, so not as heavy.
Huh.
Also, we have these sinuses in our face, and I think they kind of serve as like a Volvo crumple zone. Like when you get hit in the face, your face kind of takes all the energy and keeps your brain from getting concussed or injured.
In the face.
Yeah.
So if you get hit in the face, you're less likely to get concussed.
Yeah, if you have sinuses, because it'll just kind of it'll just collapse. You'll have a bad facial fracture, but at least your brain won't be injured.
I just learned something brand new today. That's actually a great fact right there. And so is everybody susceptible to sinus infections? Or how do you get a sinus infection?
Basically, I think it all starts with the nose. When people say nasal and sinus, they basically sometimes use it all in one, but they're different. The sinuses are called paranasal sinuses, so they connect to the nose, but they're really not a part of our nasal passage. But since they're connected to the nose, anything that causes inflammation in the nose, so we're talking allergies as a common cause, and then even just having a simple cold virus.
So it's a couple of different things then. It's allergies. Allergies could cause sinus infection.
Yeah, so allergies
Wow.
cause inflammation. You know how we all get stuffy nose
Right.
when we get allergies kick in? And the same thing when you catch a virus or a cold virus, your nose gets stuffy. It's from the swollen tissue in the nose. So that's kind of like the start of it. And then depending on the size of the sinus openings you have, with the swelling, the openings could kind of be either narrowed or clogged completely. And then now the fluid that's made in the sinuses can't get out. They get trapped. There's fluid stagnant sitting in these sinus cavities, and the bacteria like wet, moist places, and they start growing, and then you have a sinus infection.
That sounds lovely. Wow. But so everybody has different sized sinuses?
They do. I mean,
That's cool.
I do surgery all the time, and
Right.
I try to help people with sinus infections, sinus surgery. And I hate to admit it on camera, but I have probably never experienced a sinus infection or a sinus headache in my entire life.
Oh my goodness. And you were just in surgery this morning, or performing surgery. Wow. Okay.
Okay, so what's the difference? This is what I explain to my patients. Why am I lucky and why are you unlucky? And it's truly just, I guess you could say it's luck, maybe it's genetics, maybe it's just, a family trait
That's
passed
incredible.
on. If you have larger sinus openings, chances are, even if you have bad allergies, even if you catch a bad cold, it won't lead into a sinus infection. But now if you are unfortunate and you have smaller sinus openings, then every time you get sick, you're going to get a sinus infection. I have actually patients that tell me that every time their allergies kick in, they know a sinus infection is going to happen. Every time they catch a cold from their kids or someone else in the family, they know it's going to lead to a sinus infection.
Wow. So you can help people with that.
I can. Most sinus surgeries have to deal with enlarging the sinus opening, kind of making I say like, you could have a sinus opening the size of a coffee stirrer straw, or you could have a sinus opening of the size of a regular straw or a thick shake straw.
Mhm.
That's the difference. So there's several ways of doing it. There's the traditional sinus surgery, where we physically go in there and remove tissue and enlarge things. And then there's the new procedure called balloon sinuplasty,
Mhm.
which basically subtly, just maybe a millimeter or two, just enlarges the sinus openings large enough so that hopefully they don't close off when you're sick the next time.
Hmm. So, and you ultimately, you breathe better too then?
You do breathe better, but again, it's interesting. The nasal passage has more to do with our ability to breathe better, but there are other procedures we can do to help people breathe better.
Wow, that's a lot of great information. We're getting kind of serious on this show right now. So let's go into the myths and the facts. That's my favorite part. So, sinus infections are short term.
That is a myth, only because, actually the definition of chronic sinus infections is a sinus infection lasting for over 3 months. Now
That sounds miserable.
It does. Now doesn't happen frequently. Most people are miserable enough that, it drives them to go see a doctor, and then they get put on antibiotics, and a lot of times the antibiotics will help.
And then depending on how large or small your sinuses are, I'm becoming a doctor today. Then that would determine like how repetitive your sinus infections become, or if you need surgery or the balloon sinuplasty.
Yeah, exactly. Basically, it just depends on, I guess, like I said, the triggering is the allergies and usually upper respiratory infections. So if you don't get upper respiratory infections often, then maybe you will get less sinus infections. Maybe if your allergies are better treated, with maybe immunotherapy, allergy shots, or better medications, then you could have less sinus infections.
Wow, that's very, very interesting. So how about this one? Sinus infections aren't caused by allergies.
Yeah, we already just talked about that.
Right.
Yep. Allergies are probably one of the main things that initiate sinus infections. So definitely, if you're unfortunate enough, you could get sick, get upper respiratory infections maybe 2 or 3 times a year, but allergies could be with you all year round, basically. So you could be miserable.
Especially here in Georgia, right?
Especially in Georgia.
Yeah. So how about, this is very interesting. I never really think about my sinuses being impacted by dental infections. So myth or fact that dental infections can cause sinus infections?
It is a fact, and actually, they're very closely related.
Yeah.
Especially the upper teeth, especially the molars. If you look at a CT scan of the sinus, you will actually see the tip of the root of the molar sometimes pushing up into the sinus cavity. So,
Wow.
So a lot of our sinus patients will actually tell us that when they have a sinus infection, their upper teeth hurt. And a lot of people will actually, when they have a sinus infection because their teeth hurt, will actually go to the dentist because their teeth hurt. And then the dentist will evaluate them and then determine that it's not their teeth or tooth, and they'll get a Panorex X-ray and they'll see that it's a sinus infection.
Wow.
So we actually, ENT doctors, we actually get a lot of referrals from dentists for sinus infections.
Makes sense. So if your teeth are hurting, so if you decide to pull your molars out to alleviate the sinus infections, is that a good solution?
No, not at all.
I didn't think so. I was just wondering.
Not at all.
Some people don't want sinus surgery, so I'm thinking maybe pull your teeth out.
Actually, that's interesting that you mentioned that, because I have seen patients that have never had sinus problems or sinus infections in their life, and then they've had some kind of dental procedure done, like removing a tooth, or getting a root canal, or getting implants or something, and because of the proximity of the sinuses to the teeth, the procedure itself causes inflammation and infection, and then they end up having a sinus infection.
Wow.
Yeah. And then also, there's something called the oral antral fistula. What that means is that there's actually a connection between the sinus and where the, on the inside of the mouth where the teeth are. And people will have drainage from their sinus into their mouth.
Oh, well, that is lovely. What about your wisdom teeth? Do your wisdom teeth have any impact on the sinuses?
They can. Actually, if you look at people's sinus CTs before their wisdom teeth descend, you will actually see they are actually
Like up
up
in
in the
there.
sinuses. So the ones that are unerupted, and if an oral surgeon has to kind of go in there, I mean, they have to kind of go way up and almost near your sinuses to get your wisdom tooth pulled out.
Wow. Well, that's a lot of information there, but we'll continue on the fun fact and myths. How about sinus infections aren't serious?
Well, it depends on if you're the person suffering from it.
Right.
I mean, I've seen people that actually had sinus infections that, when you ask them, they're like, well, I don't really have a lot of pain. But there are a lot of people that have sinus infections that it is like excruciating pain, described like a balloon's being blown up inside their face, all this pressure, pain enough to wake you up at night, pain enough to maybe not allow you to fall asleep. So it could be, I mean, if that's you, then it's somewhat serious.
The part that I hate the most is losing your sense of taste. That drives me crazy.
It's more from the loss of sense of smell.
Right.
Yeah.
Right.
And then it affects the taste. Yes.
Right. So, what is the correlation between like avoiding cigarettes and preventing sinus infections? This is a crazy one for me.
Yeah, cigarettes, or I mean, you're talking about like, some people are sensitive to chemicals. Like some people are sensitive to fragrances and perfumes and stuff like that. So it's kind of similar to that. So I mean, what you have is just basically kind of toxic air or particles that again cause inflammation in the nasal passage.
So, this kind of putting you on the spot. Have you seen any sinus infections related to vaping?
I have not, but vaping is very similar to cigarette smoking, so it's definitely possible. And I also want to mention that, especially in kids and adolescents, there's a good correlation between having acid reflux and sinus problems.
Wow.
Same concept. You have acid vapors kind of coming up. It could affect silent reflux, affects the throat, but a little further up, and it's in the posterior nasal pharynx, back of the nose, causes inflammation. I've actually treated kids, like teenagers that come in with sinus infections. They get a CT scan, they have sinus infections, and put them on PPIs or acid-reducing medicines and gotten them better without surgery.
Wow, that's incredible. Don't do that at home. Come see Dr. Juan first. Here's another one. There is no stop to chronic sinusitis.
That's a myth because there's treatment. You could either try to control it with antibiotics or treat sinus infections with antibiotics. You can also try to decrease the initiating factor, which is allergies, or you could do surgery. I mean, I just admitted to y'all that I've never had a sinus infection in my entire life, and I'm, over 50 years old. When you think about it, I can create the same size openings that I have in you, chances are, that you won't have a sinus infection either. We treat people all the time, patients all the time, and I try to tell them that, when I treat you, or especially with the balloon, what I'm hoping for is that we hit a home run. And what I mean by that is that you don't get any more sinus headaches and you don't get any more sinus infection. I don't know if that's always possible, but I think in reality we do hit several home runs.
That is awesome.
Yeah.
Well, by chronic sinusitis, because that's more of our lingo, how do you define that?
Actually, that's defined by, I mean, it's actually a definition in medical books, but it's sinus infection lasts over 3 months.
3 months or longer. We poor souls out there. If you are experiencing chronic sinusitis, 3 months or more with a sinus, a headache, infection, whatnot, there's relief out there and there's hope. And Dr. Wan has done it, and our group can certainly do that. But I guess the myth or the fact is a sinus infection deadly, or they aren't deadly?
It is, well, they can be deadly.
Can be deadly.
Just like, very common infections. I mean, most of the time not. It's very rare. It's actually very rare to, die from a sinus infection. But it's rare to die from an ear infection, but we know that you can actually do that. And a lot of it has to do with the fact that the proximity of the sinuses to the brain.
Got it.
Basically. And sometimes there's just thin bone end. I mean, sometimes you could have a sinus infection, so you could have pus in one of the sinuses, and if it's untreated for a period of time, it could progress and basically go through the barrier and get into the brain, and you could end up with meningitis or a brain abscess or something like that. So
what are some of the serious symptoms that people might be having during a sinus infection where they really should seek professional help?
Well, I mean, I think most of the times people come in because of just severe pain.
Okay.
Pain in the forehead, pain in the cheeks, pain between the eyes, pain behind the eyes, things like that, basically. It says, well, I mean, double vision is actually kind of an unusual thing.
Have you had patients with double vision because of a sinus infection?
I have not, but again, it's the proximity of the eye socket to the sinuses.
Right.
And basically, the infection goes in and the inflammation causes swelling of the muscle of one of the, what we call the medial rectus muscle, or one of the muscles that control the eye movement. And then your eye doesn't move as well, and then you can get double vision.
Wow. So the sinuses touch a lot of different places in your head that can really affect you.
Absolutely. I mean, it's very close to the brain. It's very close to the olfactory nerve, or where we smell.
Right.
It's very close to, the eye socket. It's very close to the optic nerve, the nerve that allows us to see. It's very close to the internal carotid arteries as well.
Wow. So that's a lot. But well, thank you. Do you have anything else to offer to our guests today that might be watching the show about sinus infections or healthy sinuses?
Well, I have a lot of patients that I guess talk to people, talk to friends who've had sinus surgery before, and I've had some say, come in and say, I never really, after talking to them, it took me about a week to get better, or I had this packing in my nose and I was miserable for a few days, and I do see that. I do see that with conventional sinus surgery, but with the balloon office procedure, if you're a candidate for it, I mean, it makes a big difference. Recovery so much quicker. I have patients that leave and never have to take a pain medication. Some have to take it for a day or two at the most. And so so if you've been afraid of seeking treatment for sinus infections because of the way we've been doing it in the past, and we still do it that way.
You got a bad rap. No.
No, there is another option.
Yes.
Yeah, I've actually had patients that said, I'm glad I waited to have it done.
Wow.
I waited because I didn't want to go through it, but now that I could have it done this way, I'm glad I waited.
Right. So it's an in-office procedure. It's no anesthesia. You come in, you go home.
No anesthesia, meaning we don't have someone putting you to sleep.
Right.
We do like to pre-medicate with some oral medications to just kind of take the edge off and take the anxiety away. And then we spend, it's almost like, I mean, I hate to scare people off, but it's almost like getting a dental procedure done. And I say that because I've never had a bad dental procedure, so I don't.
That either, my goodness.
I don't know if they just get a bad rep, but basically, it's just spending a lot of time just getting you numbed up and so comfortable. So hopefully, very little is felt. It's just in and out. Hopefully, you leave thinking like, oh, that wasn't that bad.
That was easy.
And, that was easy, and I'd do it again, type of thing.
And you've had some great outcomes too. So
I have. It's a great procedure for me just because I enjoy doing them, and I just enjoy seeing the results of it. I enjoy seeing patients back, and they come back and they're happy about it, and
fantastic.
they're relieved. I mean, I have patients that it's like some patients really stick in your mind, but I had a patient that basically her story was that she woke up every morning with a sinus headache, and it didn't last long, but every morning she had a headache, and after the balloon, honest to God, she said, didn't have a headache.
Wow.
Yeah.
That's great. That's tremendous. So not only have we told you a little bit about sinus infections and dispelled some of the myths around them, but we've also have some solutions for you. There's relief, and it's available to you. So depending on where you live in the country, but we're here for you. As always, if you have any questions, suggestions, any topics that you'd like for us to cover in the upcoming weeks, we've got some fun holiday stuff coming your way. But in the meantime, shoot us a message. We'd love to hear from you. And thank you for being a co-host today on the show.